founder of LANF, so give it up for Frank.
So, welcome to everyone. Bienvenidos a todos. This is indeed really a glorious day, and it's one that is many decades in the making. Today, we begin the wonderful but difficult work of informing our communities that their children no longer need go without health coverage. I was slim and had dark hair when we first began to advocate for the idea that all children in New Jersey deserve access to quality health care and health insurance, including undocumented children. We asked at that time, and today, we asked what kind of nation does not provide health care to its most vulnerable? At the time, we were given dozens of reasons why it could not be done. Yet here we are. There are lots of unsung heroes who fought these policy battles over the last 2 decades, and thank you to all the immigrant advocates. Several of them are in the audience. I want to take a moment here to thank Governor Murphy, who has consistently striven to make New Jersey a better place and pledged support for the Cover All Kids campaign several years ago. Senate Majority Leader Teresa Ruiz, who will speak soon, never says no to children in need, and that has been and she has been one of the greatest advocates for that program. So thank you, Senator Ruiz, and I think she'll be speaking in a few moments. So today, the recruitment campaign enters a new phase as we reach out to undocumented children and their families across the state to ensure that they are insured. That is why it is fitting that we hold today's press conference at La Casa de Don Pedro, one of the most efficient and effective community-based organizations in New Jersey. Thank you, Peter Rosario, for hosting us. So through the Latino Action Network Foundation, which I am proud to chair, we will work with all community partners to reach every corner of the state. We have zero tolerance for uninsured children. The work will not be easy. Community organizers, and I'm well aware of this, having worked with them for so many years, will need to meet the community where it lives, in laundromats, bodegas, churches, and gatherings of all sorts. We will need to mobilize our state bureaucracy to do its part. In preparing these remarks, I went to the Department of Human Services website. When you Google Cover All Kids, that's where it takes you. Last night I Googled it and found that the information there was lacking. It did not indicate that undocumented children were eligible for state-funded health care, so that certainly needs to be fixed. Now, I'm going to conclude my remarks in English, and I want to speak in Spanish a little bit for those here who are primarily Spanish speakers. Welcome, Senator. I want to conclude with the message that today we are embarking on a new phase in the struggle for equality and the making of a better world. There's a quote I found from Dr. Martin Luther King Jr. that I find particularly fitting for this occasion. Make a career of humanity. Commit yourself to the noble struggle for equal rights. You will make a greater person of yourself, a greater nation of your country, and a finer world to live in. So let me just transfer now to Spanish. I think it's so important that we speak in both languages. Bueno, bienvenidos a todos. Hoy realmente un día glorioso. Lo siguiente tomó 2 décadas en la preparación. Hoy comenzamos el maravilloso pero difícil trabajo de informar a nuestras comunidades de sus niños. Ya no necesitan quedarse sin cobertura médica. Yo estaba delgado, otra vez, y tenía el cabello oscuro cuando empezamos a abogar por la idea que todos los niños en Nueva Jersey merecen acceso a atención médica y seguro de salud de calidad, incluyendo niños indocumentados. Nos preguntamos, ¿qué nación no proporciona atención médica a los más vulnerables. En ese tiempo nos dieron docenas de razones por las que no podía hacer. Sin embargo, aquí estamos. Hay muchos héroes anónimos que lucharon en esta batalla política en las últimas 2 décadas. Muchas gracias a todos los defensores de inmigrantes. Varios de estos defensores están en la audiencia. Muchas gracias al gobernador Murphy, quien siempre se esfuerza por hacer Nueva Jersey un lugar mejor para vivir y se comprometió a apoyar la campaña Cover All Kids desde varios años. La senadora Ruiz, líder de la mayoría del Senado, quien hablará un poco después, nunca dijo no a los niños necesitados y ella ha sido uno de los mayores defensores del programa. Muchas gracias, senadora Ruiz. Hoy la campaña de reclutamiento entra en una nueva fase a medida que nos acercamos a los niños indocumentados en todo el estado para asegurar que están cubiertos. Por eso es apropiado que hoy tenemos esta conferencia de prensa en la Casa de Don Pedro, que es una de las organizaciones comunitarias más eficaces en New Jersey. Gracias, Peter Rosario, por recibirnos. A través del Latino Action Network, la cual estoy orgulloso de presidir, trabajaremos junto a la comunidad para llegar a todos los rincones del estado. Tenemos 0 tolerancias con los niños sin cobertura. El trabajo no será fácil. Los organizadores comunitarios necesitan penetrar a la comunidad donde viven, como en lavanderías, bodegas, iglesias y reuniones de todos tipos. Necesitaremos movilizar a nuestra burocracia estatal para que haga su parte. En preparación de estos comentarios, anoche entré en el sitio web del Departamento de Servicios Humanos, Human Services, y encontré que falta información. No indicó que los niños indocumentados eran elegibles para el seguro de salud financiado por el Estado. Puede ir hoy mismo a verlo. Quiero concluir con el mensaje de que hoy estamos iniciando una nueva etapa en la lucha por la igualdad y la creación de un mundo mejor. Hay una cita del Dr. Martin Luther King Jr. que es particularmente apropiado para esta ocasión. Haz una carrera de humanidad. Comprométete con la noble lucha por la igualdad de derechos. Harás de ti mismo una persona más grande, una mejor nación de tu país y un mundo más hermoso para vivir. So in conclusion, I want to thank you all for coming today. It is such a great day, and I'm so pleased to be here. And I turn it back to Jesselly.
I'd like to introduce Senator Ruiz, a very fierce Latina who unapologetically advocates for our community. Senator Ruiz.
Thank you. Good morning, everyone. Thank you, Frank. Thank you to La Casa for opening the doors. When we announced this with the governor, undoubtedly I said this was a true collaboration on behalf of the legislature and the administration. For so many bills, for so many years, so many bills that we knew would protect all New Jersey and sat idly. This was a testament to the work of Senator Vitale and then an administration under the leadership of Governor Murphy that recognizes that New Jersey is very different and that when we highlight our diversity, because people are quick to stand up and say our diversity is our strength, but if you don't support that with resources and with policy that protects every single human being that calls New Jersey home, then we are short-sighted in our efforts as public servants. And so today we have a new policy that protects all of New Jerseyans. Children that don't know anywhere else except for the zip code that they've lived in, and probably will never know that they don't have a social security number until they're filling out junior year, whether they're going to take driver's ed, and then they realize, oh, hold on a second. New Jersey is not where I was born, and my pathways may be limited because I don't have access to these numbers. And we've done huge inroads in all of those spaces. But this was one of the most important things. It drops automatically as soon as you enroll, you have access to insurance. And let me tell you how important that is. Even in the private sector, when you start new employment, there's that time frame where you have to wait. And as a member of the county government, I recall parents who would call. I filled in my Medicaid application weeks ago, but my daughter is severely sick. What other governance can you give that individual except to have said go into the emergency room, because there is no other alternative? We know the emergency room is not for primary care. We know that if we make these investments in covering all children, that the outcomes and the return will be much greater. A healthy New Jersey is a productive New Jersey. A healthy New Jersey allows mothers to go to work and not have to stay at home with kids. But when we announced this, my daughter was home that day sick. I had taken her to the doctors on Friday, and of course, it's viral, you have to let go, live through it, and I get it, but as a parent, you see your child there with a low-grade fever, and we're in a Spanish room, mocos all over the place, and you're like, oh my God, what can I do? On Sunday, the fever hasn't dropped down, so on Monday, I make another phone call, and I take her back to the doctor. In moments like that, I say to myself, what about the mujer who lives next door to me that doesn't have access to insurance? What does she do in a case like this when you're panicked because you're concerned for your child? Governor Murphy, the legislature, and the Department of Human Services has said no one will be treated differently. Now that parent can make a decision to go all out and protect their child immediately with zero copay. Is that correct? The ramp up for the money. So there were all these changes that not solely protect undocumented and bring them into the fold, but really revamps the program in a way that is easily accessible and becomes a true resource for all New Jersey children. So congratulations. I have to hop on the turnpike because I'm on my way down to Trenton, but I didn't want to miss an opportunity here to come and say what's happening in this room is precisely what New Jersey needs. We have the nonprofit sector, we have the administration, we have legislators, and we have an advocacy group that every single time steps up to the plate when they even see the semblance of inequity occurring. So thank you very much.
Thank you, Senator, for making the time. So now a few words from our host, Peter Rosario.
The beauty of being third is that everything's been said, so I get to do the good part, is I get to give out phone numbers so that people can get enrolled today, immediately. That was my call to action on this. We can't wait, right? This is gonna be the social sector, this is gonna be advocacy, this is gonna be government. We have 16,000 kids to get to. And we all know that number's much deeper, right? Heather McGee in her book, The Sum of Us, talks about the solidarity dividend. That means that when we fight a battle for one, we win that battle for all. So there are white children, there are black children, there are all sorts of children in the state that do not have coverage. So whether it's here in Lower Broadway, I see someone with a Children's Home Society shirt, whether it's Route 70 in Ocean County, whether it's White Horse Turnpike down in Atlantic and Cumberland County, we need to take this battle statewide. So we just need to have everybody involved and take action. If you're an agency here that has a phone number, at the end of this, we want you to come up and share that phone number with the public. So I'm gonna give two numbers. If you are in Essex County and Newark and you're looking to enroll, or you're looking to host an event for enrollment, call Janet Mateo at 551-430-0115. Again, if you're a church, we already have our first church lined up, 300 children we're gonna enroll. So again, if you're in Essex County or Newark and you are a group that wants to host an enrollment event, Janet Mateo, 551-430-0115. If you are in Newark or in the greater Essex area, if you're an individual family looking to enroll, call St. James Health 973-789-8111. Again, for an individual family looking to enroll, St. James Health, 973-789-8111. En español, si usted vive en el condado de Essex o si usted es de Newark y necesita inscribirse o tiene un grupo que quiere inscribirse, es iglesia, si es grupo social que tiene familias que se pueden inscribir, llame a la casa, llame al número 551-430-0115 y es la señora Janet Mateo. Si es un individual que está así, que se quiere inscribir, llame a St. James Health 973-789-8111. Is somebody going to write the numbers up there? It looks great. Teamwork makes the dream work. and what I will say, we already have 5 families in there enrolling. So we're moving. So I just want to thank everybody for being here. And I'll turn it back over to Dr.
Thank you, Peter. And we will be in all those corners. I really want to highlight our community partners. We're looking to go to Morris County, all the way down to Vineland, Freehold, and we're starting off here in Essex, but we'll be statewide this year enrolling children. So next on the speakers list, we'd like to introduce from the governor's office, Shabnam Saleh. Thank you.
Good morning, and thank you so much for first to Latino Action Network Foundation and La Casa de Don Pedro for hosting this event. It's so exciting to be in the room and just feel all of the energy. This is such an amazing day for not only for families and communities, but really for the entire state. So I'm thrilled to be here on behalf of Governor Murphy to highlight the Cover All Kids initiative and really just do all that we can to spread the word about newly available Medicaid coverage for immigrant children. Right now, like you heard, any child who is eligible for Medicaid, regardless of immigration status, can sign up for coverage here today. So thank you for all of the efforts to just make sure this benefit is live. We talk about a benefit going live, but there's nothing more live than all the work you're doing here today to make sure as many people have this information. So, and many other community-based organizations across the state that we know are doing this work. And of course, NewJerseyFamilyCare.org for more information. This announcement today represents the governor's ongoing commitment to making healthcare more affordable and accessible for all New Jerseyans, and to support New Jersey immigrant communities, especially, and expanding access to resources and services we know are needed in the community. The Murphy administration has been investing in maternal and behavioral health services across the state, has invested significantly increasing access to childcare to more families, and so much more. I'm excited to also be joined by my colleague Joanna Kaye from the Office of New Americans, which was an office established just a few years ago under Governor Murphy's direction, also the Department of Human Services, to really spearhead efforts to meet the needs of immigrant families new to our communities and new to our state. So that's been a really exciting new venture under this administration as well. So through this initiative, we're working to ensure that no child in New Jersey goes without health insurance coverage. As the governor said a couple weeks ago when he announced this new benefit, that investing in regular and consistent coverage for our children is truly an investment in the peace of mind all New Jersey families deserve, and no parent we know should have to worry about the cost of taking their child to a doctor when they need to. As a child of immigrants myself and growing up in New Jersey, I distinctly remember being about 7 or 8 years old when my mother first learned about New Jersey Family Care, came home with a long application, which I think was longer at the time than it is now, and enrolled me and my brother and my sisters into coverage. I remember how important it was for our family to have access, and we all know that this is something that all children in our state deserve. So since launching Cover All Kids in 2021, the Department of Human Services has already made important strides to support the enrollment and expanded coverage to over 40,000 new kids in New Jersey Family Care. It's the tremendous leadership that is really due to the tremendous leadership at DHS and Commissioner Edelman and colleagues like Carol and Joanna that have helped get us there. I know there's just so much excitement that we feel in the room today, but across communities, across the state, to really help make sure this new benefit is reaching folks. Again, this would not be possible without the critical work of community partners like you all, and we're so grateful for that. And really appreciate the efforts that I hope we will see, and we know we look forward to seeing across hospitals and health centers, schools and child care centers, legal services, and other important pillars in the community to make sure folks get this information. So through our collective efforts to reach every child in New Jersey, we're ensuring the health of our children and families and our broader communities and our states, and our state. I'm proud of the governor's commitment to healthcare affordability and accessibility across New Jersey. And again, thank our colleagues at Department of Human Services, Commissioner Edelman, and of course you all for all of the work that you do to make this a reality. Thank you.
Thank you. First of all, give it up to our DJ Lady C. Bringing some of that feels into the room. So now I'd like to introduce Joanna Calle, a longtime ally. Joanna, really nice to have you here today from the Office of New Americans.
Thank you, everyone. It's so nice to see all of you. So first, thank you to our hosts, Casa de Don Pedro and Latino Action Network Foundation. DHS is proud to expand healthcare to all children in low-income households regardless of immigration status. I know folks have been saying it's a long time coming, and I know many of you have worked really hard to make this happen. And on behalf of the department, we're incredibly grateful for that. This is one step closer to continue to what our state has already been doing, which is expanding healthcare to those who need it and being welcoming to all, because that is the legacy of this administration and this state. At the Office of the Americans, we understand that reaching immigrant communities means partnership with trusted sources of information, removing the language barriers, and increasing awareness of these vital programs. Actually, we actually have a new website coming soon, so you'll see that coming as well. There was a press conference, as this was alluded to, which included, I think many of you are on our listserv, one-pagers and materials that were created to make sure that the community is aware of these programs in various languages. So we want to make sure that folks feel comfortable coming forward. And we hope that all eligible families come forward and feel comfortable going to njfamilycare.org. I'm actually going to give one more phone number, if y'all could help me with that. 1-800-701-0710. 1-800, we'll slow it down. 701-0710. So folks can come forward and learn about the application, learn about the program, and in fact, if you call that number, you'll be able to reach an interpreter that will help you walk through the application in various languages, not just in Spanish. So please, if folks can, go ahead and reach out there, along with our website, and there'll be more additional materials that will be available for the community coming soon. This program is safe, it is accessible, and we really hope that it will help our children obtain the health care that they need. So we look forward to continuing working with so many of you, community stakeholders and partners, to spread the word and to support the families as they apply to this valuable program. I'm going to say that in Spanish. So buenos días.
Yeah.
Primero quiero agradecer a nuestros anfitriones, Casa de Don Pedro y Latino Action Network Foundation. El Departamento de Servicios Humanos del Estado de New Jersey está bien orgulloso de extender el seguro médico para los niños en hogares de bajos ingresos sin importar su situación inmigratoria. Este es un paso más adelante, ya que nuestro Estado continúa siendo acogedor a todos y sigue extendiendo el acceso de cobertura médica para los que la necesitan. En la Oficina de los Doctores de la Oficina de Nuevos Americanos también entendemos que el alcance a nuestras comunidades inmigrantes tiene que ser en consorcio con fuentes de información que tiene la confianza de esta comunidad. Y también tenemos que asegurar que esta información sea en su idioma y que aumentemos el conocimiento de este programa y de este programa que es tan importante. También queremos que las familias que califiquen por este programa se sientan cómodos en venir a la página del internet y llamar a este número. Este número que acabo de decir aquí está disponible en varias lenguas. Ustedes pueden llamar en cualquier idioma y van a traducir la aplicación, la información, para que puedan entender toda esa información y tengan la ayuda que necesitan para llenar esa solicitud que es tan importante. Este programa es seguro, es accesible y es necesitado. Nosotros sabemos muy bien que es necesario para que los niños tengan el cuidado médico que tantos necesitan. Seguiremos trabajando al lado de nuestros aliados y nuestras organizaciones interesadas para educar a la comunidad y para apoyar a las familias que apliquen a este programa que sabemos que es tan valioso. Entonces, muchísimas gracias, estamos aquí para poder apoyarlos. Una cosa que también quería, antes de olvidarme, es que va a haber una nueva página de internet con más información, y cuando el gobernador hizo el anuncio hace unas semanas, también nosotros espartimos muchas informaciones y creamos folletos, materiales en diferentes lenguajes e idiomas para que la gente se eduque de este programa. Entonces, si ustedes son organizaciones o aliados, por favor pónganse en contacto con el Departamento de Servicios Humanos. Nosotros tenemos los materiales que necesitan para comunicarse con la comunidad. Muchísimas gracias.
Joanna, just to confirm, para confirmar, is zero deductible?
Carol, confirm for me.
Co-pays, yes. Premiums, no.
Okay, covers mental health?
Covers
Yes.
mental health.
Yes.
All done.
Okay.
That needs to be said in Spanish or Roby, Creole, French.
Yes.
She could say it.
Zero, and I'm not gonna do that today, but I'm gonna say zero copay and covers mental health as a licensed.
Yeah. Co-pays, based on income,
Based
are
on-
required for all, but premiums, no.
Premiums, no premiums.
No premiums, no waiting period.
No waiting periods, no premiums, and covers mental health. As a frontline mental health worker for many years, I treat a lot of undocumented children whose families will become completely destabilized because they don't have access to their basic needs. So I'm really, really excited about that because mental health is also health. So I just want to make sure that we speak about that today. I'd like to open the floor up to our advocates who have been tirelessly fighting for this, an uphill battle for many, many years. So I'd like to introduce Laura Waddell from New Jersey Citizen Action.
Thank you, Jesselly, LANF Foundation, the Governor's Office, the department, all that are here today, our partners at the consortium. I should just say ditto with what everybody has been saying. But this month's Phase 2 expansion of Cover All Kids is, what we've been looking for, what we've been working so hard to finally see, and perhaps it's apropos that it happens in this month. And my Spanish is a little rusty, I suspect that Frank touched on this, but it's apropos that it happens this month as we celebrate Reverend Dr. Martin Luther King Jr.'s birthday, who said all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And when the New Jersey Family Care Expansion legislation passed in 2020, I believe it was being reported that there were between 80 and 90,000 uninsured children in our state. And since then, I believe, as was mentioned, that those numbers have about been cut in half since the rollout. So there now will be 16,000 more children who are eligible to enroll in New Jersey family care coverage, regardless of immigration status. This is the first step to ensuring more healthy outcomes, because these children will now grow up with coverage that they will be more likely to use, which can prevent health issues before they become serious. This is how we level the inequitable scales in healthcare that the Reverend Dr. Martin Luther King Jr. spoke about. And this is how we begin to reverse some of the healthcare disparities that are so heavily weighted in our communities of color. This is how we give our children access to a healthier future. We're here today in Essex County, which has the highest amount of uninsured children. It was reported, I believe, in last summer that there's about 12,000 uninsured children just in this county alone. And New Jersey Citizen Action, along with our 16 other navigator organizations, is happy to help families enroll your children in coverage. For free enrollment assistance, call us. Another number, 888-654-3893, or email us. Sure, 888-654-3893. Or you can email us to schedule an appointment at getcovered@njcitizenaction.org. We have assisters waiting and willing to help in both English and Spanish. And we know that there is more work to do to ensure that every child and family across the state have access to health coverage and the care that they need. And we look forward to working with all of those represented here today to build on this progress and make that next phase in coverage a reality. But today, this month, let's celebrate this historic achievement with all of you, with all of our families, and all of our immigrant partners and communities. Thanks so much again, Jesselly.
So for our last speaker for today, so before I get to our last speaker, I know this is a big ally of ours, the NJ Consortium for Immigrant Children, and I'm going to say it again. Cover all kids, and family care covers medical, dental, and mental health care. Okay, so mental health is health. So please share that widely among the community. So I'd like to introduce a great friend, Lady Torres-Jimenez from the NJ Consortium for Immigrant Children.
Buenos días. Buenos días. Hoy estamos de celebración, and it's a true cause for celebration. My name is Lady Jimenez Torres. I am the Policy Director for the NJ Consortium for Immigrant Children. We work with New Jersey's immigrant children and youth and their allies to advance their full and fearless participation in our garden state. We champion policies and initiatives that drive us towards equity in education, access to justice, and the reason that we're here today celebrating healthcare equity, because all these three things are related. I am thrilled to join dignitaries like Senate Majority Leader Teresa Ruiz, who was here earlier, a barrier-breaking Latina, Peter Rosario, who is a true example of leadership for our community, Frank, and all the people at LANF for putting this together and who are a cornerstone in our community and are avid advocates for basic rights. We commend Governor Murphy, his office, the Office of New Americans, the Department of Human Services for their leadership and support of progressive policies for all families here in New Jersey. And last but not least, we want to thank all the advocates, behind the scene champions, because there were many, community members, and every single person that supported this effort in moving the needle in New Jersey. As an immigrant myself, and an immigrant that grew up without healthcare access, I know firsthand the impact that this is going to have for children here in New Jersey. As a mother, I know what a relief this will be for parents, where they can rest assured that their children are going to have access to healthcare, that they're going to have access to basic services. It is a true honor to be part of this and to celebrate with you today. We are proud that New Jersey is a leading state in advancing the rights of immigrant youth and in advancing health equity for immigrant children. New Jersey continues to rank 5th in the nation for the reunification of unaccompanied minors with sponsors, with nearly 7,000 children last year. This expansion is going to create stability in health outcomes for all children, and it's a future investment for our great state, because your children, they're here to stay, and they're going to grow up here, and they're going to come back, they're going to become adults and give back to our community. Healthy children have the tools and greater chance to succeed in other areas. and I'll repeat it again, Jesselly, Cover All Kids is going to provide the same coverage that all other state-sponsored plans provide. This means that our children are not going to have access only to affordable care, but comprehensive care. And that's different, right? Comprehensive care means that a child is going to have access to eyeglasses so that when they're sitting in their classroom, they can look at the board and they can see what's written on the board. Dental care, so that a toothache doesn't become a larger barrier for their education. And mental health and counseling services, because unfortunately, some immigrant children have to bear witness to extreme acts of violence. And they will not have access to care that's going to help them process, it's going to help them grow, creating the framework for our children so they can thrive in other areas of their lives, not only physical, but social and emotional as well. This expansion is just the beginning in making healthcare accessible for all children in New Jersey. Today we're celebrating knowing that there's still road to cover as more families learn of Cover All Kids. NJCIC and all of our members are ready to continue our advocacy with the state. We know implementation is an ongoing process, and there's going to be times where we might have to go back to our meetings and bring up issues that might come up and review what works and what doesn't. But we will continue to work with the state in offering recommendations as challenges to enrollment and retention, because we just want to enroll children. We want to make sure that they retain their health care. But today, like my partner at the New Jersey Citizen Action said, we are celebrating, right? This is a great step towards a more fair and welcoming New Jersey. Celebremos que estamos aquí y celebremos las políticas progresivas en nuestro estado. Gracias.
So that concludes the formal list of our speakers, but I really want to offer an opportunity for all of our community partners to come up here who provide direct services to the community and share their information. We have partners here not just from Newark, but from Morris County all the way down to Cumberland and Cape County. So eso es para las familias por el estado entero. So I'd like to first ask Marcela Lennox from Morris County Organization for Hispanic Affairs to please come up and provide a direct number where families in Morris and Sussex County can reach out to for enrollment.
Good morning, everyone. I'm happy to be here and be part of this. We want to offer our office in Morris County. We're located in Dover, and our phone number is 973-366-4707, and we're gonna have a promotions day where we're gonna be available to help the families in Morris County. And we also want a partnership with the schools and the daycares in the area.
We're going there too. I'd like to invite up Jossie from the Puerto Rican Action Committee of Southern New Jersey.
Hello, everyone. We are super excited to be here today, and I think this is really exciting. And I'm just going to provide our office information. So we would love to collab and definitely have this in our location as well. We're located in a few offices, but I'll give you our Cumberland. So we're all the way from Vineland, New Jersey, and that is 856-213-6693. Thank you.
So thank you all. That concludes our comments for today. I really want to thank you for joining us today. It's a celebration, so please make sure to share this far and wide. Families are enrolling literally a few feet from us as we speak. This is a huge win for our community, and we have to keep fighting to maintain it, just like as Lady said. So thank you all.
Jesselly, I think we should also acknowledge our media partners, because they're really going to be the ones that help us get the word out. So we want to thank them for being here.
Yes, thank you to the media for Newsflow for coming and highlighting this and making sure that the word gets out to our communities. Cover All Kids is now available to all children, regardless of immigration status. Here are a bunch of numbers that you can call, access medical, dental, and mental health care, comprehensive care for all of our families. Please call and enroll. And if you have any issues, I'll tell you who to call. Enrolling. You can call us at the Latino Action Network Foundation and reach out to us, our community partners, if you start to see issues in regards to enrollment, so that we want to make sure that this program is successful, right? So we will be helping the state ensure its success, right? So thank you.
Is there a phone number to report somebody who denies care to a family in the state?
1-800-701-07.
Can you say that again?
So, with any issues,
Can
with
you give it a?
Hi, good morning. Iris Novas Cooney from Horizon Blue Cross and Blue Shield of New Jersey, specific to the government programs. NJ Family Care main number, the 800-701-0710, is the centralized number. Any issues, barriers, once the application has been reviewed, I encourage you to call that number. You could always contact me. My number is 201-936-4230. I'm happy to connect you to any local resources and navigate through that process as well. Iris Novas Cooney. Thank you.
Again, so if you have any issues accessing Cover All Kids for your children, please contact New Jersey Family Care. But if you really want to complain, you contact the Latino Action. Thank you very much.